Ya tenemos español y portugués, yo creo que podemos arrancar.
Ok, muy buenas tardes a todos.
So English and Portuguese already, we're going to start. So good afternoon, everyone in the world, in the international rare disease and orphan diseases. We would like to welcome all the institutions and organizations that are joining us, the panelists, and our audience that comes from all the corners of the Americas region. My name is Felicitas Colombo, and I am Director of Public Affairs and Governmental Affairs from the Americas Health Foundation, a foundation that's based in Washington and promotes the access to better quality of health through the cooperation between different stakeholders in the region with public policy programs, awareness, and sustainable education. I am joined by Dr. Mariana Rico, Medical Director of the Foundation, who will be moderating this panel together with me. It is our great pleasure to present the organizations that have supported us to carry out this event, the Enfermedades Raras en Latinoamérica, Diálogo con Expertos, the Rare Diseases in Latin America, Dialogue with Experts, that has the purpose of increasing the awareness on rare diseases and orphan diseases throughout the region with a dialogue with experts in these topics. To begin, I would like to thank all the organizations that made this event possible by starting by the Foundation Chan Zuckerberg Initiative, CZI, who have supported us with their sponsorship and this platform that we're consolidating in Latin America. And for this, I would like to welcome first the representative of the rare disease in Latin America. Sorry, we're having some audio difficulties, but here's Stephen Groff.
And the speakers and participants who agreed to join us today to talk about the needs of the rare diseases, patients and families, the researchers, and even the government agencies that are involved with the rare disease activities and the biopharmaceutical and medical devices industry. So we have many partners and a lot of different activities. So thank you all for joining us. To make it very quick, please visit the website regularly. We will soon be posting the 8 different work groups that we're going to feature to have an emphasis on rare diseases throughout the region. And so please look at the ERCAL website, and we are always in need of volunteers. So thank you for joining us today, and I'll pass it on to Dick because I know time is short. Thank you very much.
Thank you, Steve, and we'll continue. Por parte de la America's Health Foundation, nos acompaña su presidente, Richard.
So now from the America's Health Foundation, we have Richard Salvatierra. So good afternoon, everyone. Thank you for your support. I would also like to thank one of our sponsors, the Chan Zuckerberg Foundation, the American Health Foundation that's based in Washington, where I'm currently, right? And it's a pleasure to get to know all of you. But more important, we appreciate all the effort that's being done, and for us to be working together with you and to provide support in this big initiative. It's a pleasure, it's an honor, really honored to be here with you. Thank you, Dick. And of course, this wouldn't be able to happen without the federations from Argentina, Brazil, Chile, Colombia, and Mexico, who I would like to extend a very warm thank you, and all the directives. We're going to start with Lucia Scati Peñalosa from the Argentinian Federation of Rare Diseases. So yeah, it's a great pleasure to be able to join you. Thanks to the sponsor, to the organizations, to everyone joining this call, particularly us as a federation. We're really glad to be able to show the journey of the patients and we're really close together in terms of the Latin America and Central America region. We know that it's a long journey and a difficult journey for the patients of rare disease, and we know it's difficult, but we always try to carry out these events so that all the countries can adapt all the different strategies and techniques to their local context so that this public policy can provide significant answers to these millions of people that are suffering from rare diseases. Thank you, Luciana. Now we're going to have we're going to hear from Antoine Barra from the Brazilian Association.
Muito obrigado. Olá, amigos. Acho que posso usar essa palavra, apesar de não conhecer pessoalmente a maioria de que estão aqui. Temos muito em comum.
Quiero agradecerles, amigos, por invitarme. Tenemos we have a lot in common. Thank you for joining. We're fighting, we're in the same struggle, we're all in the same fight. And we're fighting to guarantee the rights of the patients who suffer rare diseases in all Latin America, in Chile, Mexico, Argentina, Brazil, Colombia. We've seen the same routines, we've seen very similar strategies. But today it's a very special day, not just because we're celebrating the International Day of Rare Diseases, of the fight against rare diseases. And we're living through a very strange times, and we believe that the pandemic has highlighted the importance of exchanging ideas, strategies, and practices. So we're very thankful for the opportunity to be here. We would like to thank the sponsors, and we would love to have an in-person event where we can delve more into these dialogues. Brazil gives you a big hug to all of you and warm regards. Now we have Antoine Daher, sorry. We have Judith from Chile, from the Chilean Federation of Rare Diseases. Thank you all. So yeah, once again, we all have the same goal. We hope that we can work in cooperation and we can represent all the patients. This is a very big first step to continue working in a comprehensive solution for the patients and the families and the citizens. And we can finally provide answers and treatment to the patients. From the Chilean Federation. Sorry, we're having audio difficulties. We understand the symbolic value of this event, and we believe it's very important, and we would like to thank you for the invitation. Thank you, Judith. So from the Colombian Federation of Rare Disease, we have Diego Gil Cardoso. Diego? Diego is in the waiting room, so if the technical support can grant him access, please. We're gonna wait for 30 seconds for Dr. Diego Gil to join us in the room. Diego, can you hear us? So while we wait for Diego to join, we're going to jump to the Mexican Organization of Rare Diseases. We have Jesus Navarro. Jesus, are you here? Okay, so once they join in, we will introduce them. But just to start, the first discussion table that we proposed, we're going to go delve into the topic. So maybe if we can have a general overview and we can express or tell you that there are over 7,000 rare diseases, that most of them have a genetic cause. So according to ORFA.net, approximately between 4 to 8% of the world population has a diagnosis of rare disease. This means 300 million people. This represents a very large group of people that require special attention in terms of health service. In the past few decades, the attention has increased and the effort to stimulate research, development, and access to treatment and drugs for rare diseases. Even when we have advanced a lot in terms of public policies and regulatory frameworks, we still need a lot of reforms to do it. Currently, the data from rare diseases in Latin America are scarce. The population in Latin America and the Caribbean, according to the World Bank, it's around 650 million people that suffer rare diseases. So based on this data, we estimate that between 26 and 52 million people live with one of these conditions. Even though we've seen progress, we're still facing really difficult challenges in terms of regulations, infrastructures, register, and public policy, among others. The goal is to start a conversation that will analyze the current landscape and evaluate the challenges and strengths in the region. So I would like to welcome the panelists for this first discussion, which is titled Challenges and Opportunities in Rare Diseases in Latin America. We're joined by Dr. Marisa Aizenberg from Argentina, head of the Academy of the Health Faculty of the U.B.A. We have Dr. Gustavo Mendes from Brazil. We have Dr. Gabriela Repeto from Chile, who is in the program, who's the director of the program of rare diseases in the Universidad del Desarrollo in Santiago de Chile. Dr. Germán Escobar Morales, Vice Minister of Health and Social Welfare, and also Dr. Santiago March from Mexico, who is coordinating the strategic projects of FonSalud. So thank you for joining us. Sorry to interrupt. Diego is here. He will be instead of Dr. Germán Escobar Morales. So we have Diego Gil Cardoso from the Colombian Federation. Thank you, Diego, for joining us. So we will be in the experts panel. Thank you, Felicity, and thank you everyone for joining us. Right now we have Dr. Nubia Bautista. She joined in so she can cover Germán Escobar Morales, and she's going to be representing the Colombian side on that round, on that table. So thank you, Nubia. We're very glad to have you here joining us in this panel. But going back to the table, I would like to start the discussion by setting up some definition. So according to the World Health Organization, we have a rare disease is that affects 5 people in every 10,000 inhabitants. However, in the Latin American region, there's a broad range of classifications. For instance, in Brazil, a disease is considered rare when it affects 65 or less inhabitants per every 100,000 inhabitants. In Colombia, it's considered a rare disease when it affects 1 out of 5,000 individuals. And in other countries such as Argentina, Chile, Mexico, Panama, and Uruguay, they consider a rare disease that affects 1 out of every 2,000 individuals. And this leads me to the first question regarding the homogeneity of the definitions. And we're going to talk about the impact of not having a homogenized, a unified definition of a rare disease, such as the case of the European Union, and what are the barriers that these different definitions put up. So we have the epidemiological data, access, public policies. What are the challenges, basically, that you see arising from the different definitions in the region? Because the definition is always the central pillar on which all the public policies are supported and everything that is built around it. So let's try to talk about this. What does these different definitions mean, and what's the impact? Okay, so I'm going to start, because if you're working on alphabetical order. I'm used to starting because of my last name. So first of all, it's a pleasure and an honor to be sharing this space, which is absolutely relevant, especially in our region, which is one of the most regions that faces the largest rates of inequality in the world. So I would like to highlight the importance of a single definition of a rare disease, of an orphan disease. Look that we even have it's like a Babel tower in terms of the defining this problematic. But I would just like to highlight that it's really important to set up a definition for the protection of the rights, because a definition allows you to set a frame, it allows you to set up the scope and the bridge of the policies. And based on in function of this, we notice that the scope of the regulatory frames in our region facilitate in some cases, but also sometimes, because this has been part of really long discussions, sometimes it sets barriers in terms of the diagnosis, of proper treatment, of health and social welfare. And it has a big impact on public policies, because our states, our nations need to define strategies. And here is where I turn to Gabriela Repeto, who I greatly admire. We have deep working bonds with the university where she works, and we have this alliance with the academy, and the academy has a transcendental role in the research, the study, and the transfer of technologies, not from the scientific ambit, but also towards society. So these programs, we've designed a program that's been really successful, and we've called it Patients to Citizens. How can you acquire a different role within the frame of the rights within our societies, without leaving aside or without forgetting that the pandemic set up a lot of challenges and barriers to the ones that already existed. So thank you. That's what I wanted to say. So, Doctora Repeto, yeah. So, yeah, it's key to have a single definition, just to know who are the people, where they are, what are their needs, but also to measure, to start setting up metrics for the public policies. And we can start measuring the achievements, the results, the outcomes of the interventions, to identify good practices, best practices, and see how we are setting those keystones from knowledge. And from the definition, we start to branch into very different ambits, whether it's personal, professional, health level, health system, political system. So it branches from there. From the definition, you can reach many different ambits. So to reach a unified, do you think that it's possible to reach a unified definition like the one that the European Union has? Dr. Santiago March, please go ahead. Yeah, good afternoon, everyone. So first of all, regarding the epidemiological definitions, these are not going to be, we're not going to be able to coincide and set up one single until we have a really concrete, really well-defined map on rare diseases. So the countries that already have done a research, that have a good register on rare diseases, might paint a more closer picture to reality. But the truth is that out of the almost 8,000 diseases that have been classified as rare, we still don't know which of these 8,000 are the ones that are present in Mexico. We've done some estimates, we've elaborated some lists, we've done some review of the literature, but the truth is that we still don't know what's the exact number. Now, in terms of regulations here in Mexico, we're always talking and identifying rare diseases, but there are some other terms that for public policies, for regulatory frameworks, such as low frequency diseases or orphan diseases, we know that at some point they can start facing or fighting with the rare diseases as they are consigned in the general health law in Mexico. Another point that we're also trying to understand and try to study is that in some countries in Latin America, the term rare has a connotation that can be offensive. That's why they use other terms such as low frequency disease, that it's a term that it's, let's say, more, that is softer. And also here in Mexico, we have defined rare diseases. We will have to keep calling them that way in order to avoid those mix-ups. So that's what I want to say. Dr. Mendes?
Perdóname si hay algún problema con mi conexión.
So I'm sorry if my connection is not really stable. It's a bit unstable right now. But I would like to say that I'm going to be sharing from a regulation perspective. And from the point of view of the regulation, it's very important to set the definitions, because here in Brazil, we have specific policies that are set up in a regulatory framework for the approval and the diagnosis of the products that are aimed or that the purpose is to treat rare diseases. So we must unify definitions in that terms. And I think that as a regulator, it's not too difficult if we start thinking that for this, in order to define which are the products, drugs, treatments, services for patients with rare diseases, we need to do a framework based on data that has a perspective or a point of view that is discussed from an international perspective. So it's really important to unify the epidemiological data. But for regulators, we must present figures, data that it's unified and that can be used as a reference so that we can develop the fast track strategies, considering the research, the studies, the specific studies that are being conducted on those topics that obviously need some particularities of different contexts. But here in Brazil, we're very open to discussion, and it's very important, and we're very willing to reach a unified figure that can be used as a reference in all the region. Well, thank you very much. And if we can continue on that same line of questions and a little bit delving into what Drs. Gustavo and Santiago were mentioning, we know that there is a big gap in terms of the frequency, prevalence of rare diseases. And we know that there's a real challenge to give an accurate representation and accurate figures on the landscape of the rare diseases in the region. And we also know that establishing these figures is extremely important from the point of view of the regulation, of research, of medical research. And there are some mechanisms, some surveillance mechanisms, monitoring strategies that have already been set to achieve this goal. But we know that there is still a big gap between the monitoring systems and the estimated figures. So my question is, what do we need at a national level and at a regional level to increase the data and surveillance and monitorization of these rare diseases? Dr. March? Yeah, thank you. I would just like to tell you that here in Mexico, we've identified, well, four actually four main topics, four main subjects to achieve a better management of rare diseases. The first one is training and education to first level and first contact physicians. So in many countries, it's thought that this should be left for the geneticist and pediatrician specialized, but that might not be the best strategy. The second topic, which I think we all agree, is that we need a national platform for molecular registry. There are a lot of diseases and there are a lot of conditions and contexts where we cannot do that diagnose. And the third one is a national registry. And the fourth one, which we all do, and I think we do it really well, is sharing rare diseases, sharing and talking so in events such as this. But we must not forget the other three. So in terms of molecular diagnose, which is my area of expertise, we've visualized that in Mexico. We've seen that in Mexico, since there's a lot of hospitals or of third degree hospitals, many of the times the protocols are not standardized, they're not harmonized, and there are different capacities for the diagnose. And we feel that this is also a challenge, a barrier to achieve clear figures on rare diseases and where they're located. So to map this rare disease. Now, Dr. Bautista, yes, you go ahead, Dr. Bautista. Yeah, thank you, Felicitas. Thank you, everyone. First, I would like to speak on behalf of Dr. Germán. He had some really important meetings that he had to do to attend from in the ministry. But so he excuses himself. And I think that Dr. Santiago March mentioned the fundamental aspects. And I would just like to say that the effective capacity of the health systems is where we're missing a big opportunity. Even if we have a surveillance system, such as the one in Colombia, we're missing a lot of data if those first physicians, the physicians that first attend the patients are not aware of the strategies, then we're missing a lot of data. And also, it's really important to set up that register, to follow the epidemiology and to have concrete data. And sometimes there are delays in the system and they generate disparities in the final information. So we believe those are two fundamental aspects where we should focus on. Okay, so Dr. Repeto? Yeah, I completely agree with what my colleagues have said. The information and the registry are fundamental, but we also have to think, how can we do that? And I feel that education and clinical education on rare diseases, it's something that is very difficult because those of us who work in that, it's really difficult to explain and to teach and to educate people on these topics. For us, it's easy because it's what we've done all our lives, but it's really important to set up those clinical tools and the digitalization of the health systems and create alert systems for health professionals to raise the alarms, because a lot of people don't know about this, and we will take generations just to generate this knowledge, to share this knowledge. And as those other sectors start catching up to the knowledge that we're providing, we need to generate those tools to provide support for quick, fast, and effective diagnose. And this is not just for doctors. This is for anyone in the health area. And it's also very important to generate that electronic alert so that we're not duplicating the results and the data. Dr. Marisa, please go ahead. Yeah, I would like to also highlight the health policies. Not all the countries, not all the nations, the interior and the fragmentation of the territories, because a lot of regions lack the reference centers, attention centers. So it's setting up a network on all aspects. It's integrating all the different aspects, because we're always seeing that the big cities are the ones that are most benefited. And we know that there are social, economic, cultural barriers that derive into access issues. So in order to reach a good health attention services, decrease the attention times, we also seeing a lot of lack of professionals that sometimes end up in the worst case scenario, which is judicial instances, because the contention of the public, of the health system, should have something that they should have addressed. And they're not, the problem is that they're not left outside of the big inequality of the systems that are set up in the countries. And Gabriela was mentioning something really interesting, which is we must incorporate everything that we learned during the pandemic in terms of the digital health, all the possibilities that long distance care can offer us. We have these platforms, these cooperation platforms, these learning platforms, from undergrad programs. There's a new way of thinking health attention and healthcare. There's a lot of innovation. We can innovate. We have to start looking into AI inclusion into the systems, how to approach patients and the population through social media, through all these tools that we currently have. And it's also the registry systems must innovate and include new tools in terms of diagnose and identification of rare diseases. Yeah, well, everyone is bringing really interesting topics where we would like to deepen into, right? And it's really difficult to separate all of this and to discriminate because they overlap. But in talking of registry, what are the opportunities that we currently have in Latin America to develop the participation and increase the participation and lead to a regional registry? Dr. March, please go ahead. Yeah, thank you. Well, I don't know if it's the best strategy is to start with a regional registry. I don't know if it's the best. I honestly don't know, but it's something that we can try. Here we have different advanced levels, different advancement levels. I think that the patient organizations here in Mexico, there are many that have really comprehensive registry. I don't know what's the case in other countries. I think that Argentina, Brazil, and Colombia also have those. So it's important to take advantage of those registry from patients' organizations. And I'm sorry, I might be jumping or discussing a different topic, but since there are different regulators here, in terms of medications, because we're seeing that at a global level, we're currently seeing new medicines for rare diseases, but there's a lag. What happens if in Mexico we identify a specific rare disease? And what happens if that drug is not approved for its use in Mexico? So we have that inequity topic that Dr. Marisa has emphasized on. So I see that there are many different lanes and different efforts that must be worked in parallel. Because if I have the registry, but I don't have the medicine, then there's a big problem. And another topic that I want to put on the table is, even when we have advanced a lot in terms of public policies, of regulations, it's also very important that we have these economic studies, this cost benefit research in terms of rare diseases, so that in the future, at some point, we can explore the funding ways to support these programs. And I would like to tell you that here we studied a case in Brazil in 2010 with President Lula da Silva, where there was agreement for management of lysosomal diseases that was very interesting between the government of Brazil and a lab. And it was very successful because it allowed to achieve this equity that we're all looking for. And I think that's a very important case study that can help as a reference, because we have those really replacement therapies that are really high cost that we must not forget. Dr. Gustavo Mendes, please. You have the floor. Well, I would like to share a little bit of the experience that we've had in Brazil with you, especially in this that we were talking about. Because here in Brazil, we had two moments. We can divide the story into two different moments. We have the regulatory assessment, the moment where we assess the risk and benefit of the medicine, of the drug. And that's an aspect that there must be a special evaluation, because sometimes the products don't have the complete research and studies backing them up. And this is something that is precious for us, for the regulators. So it's something that we must discuss, exercise, and reach compromises and commitments with the labs. And then here in Brazil, we have the second moment, which is the incorporation of the product into the health system, which is an assessment, a cost-benefit assessment. And this assessment that Santiago was mentioning is something that, we must have specific policies that must be considered here in Brazil. For instance, the export and the import of patient registry, because it's not always possible for the government to establish those registry and connect all the different information that it's needed for the continuity of the product. So this is it's fundamental. It's key to have a dialogue with the labs, and that the labs are open to implementing, in cooperation with the government, the strategy to generate a continuous assessment of the products and the services, because we know there's a lot of hope of the patients and the families put on these treatments and drugs. That's why we need a constant and continuous assessment. So it's important to share the risk with the lab, and this means a commitment from both parts. And we must think and address it from the side of the lab and the side of the government. Well, thank you very much for all the comments. This is really interesting. And now this leads us to the participation of the different stakeholders, and the opportunities and the needs at a regional level, especially in research, and which are the key stakeholders that we should bring. So we're just giving a very general overview. We're talking broad strokes. I would just like to give a quick overview on the region, what's happening with these different topics that we're talking about. Dr. Aizenberg, yeah, you have a comment? Yeah, thank you, Felicitas. So let's say we're generating the basic thread of the possibilities of setting up definitions, and research is linked to data production. So data production, and data that can be acknowledged at a regional level, and the transference and the sharing of information is key. So understanding that we must sometimes the social civilities, or sometimes no, the social civility cannot replace the work of the government, of the public organizations. And what we've seen is that many times these patient organizations, these civil society organizations, are replacing the responsibilities and the work of the public responsibilities of the public organizations. So it's really important to consider this, but it's also important to set a reference of the public policies in order to develop the solutions that Gustavo was mentioning, that Santiago was mentioning, that escape from the financing and technological traditional assessments. So introducing drugs into different schemes and systems, it's really difficult. So what we need right now is to generate different models, new models, and data are the key here. Data is king. We need this in order to generate this, in order to grant to secure transparency, to grant distribution, to open possibilities into new research. And there are new models, and one of them is the open data, open source data research. We need to work into open data sharing, having this information, having this vital information that is key to generate new researches that can give and can improve the quality of life to the patients is key, it's paramount. Yeah, thank you, Dr. Aizenberg. And we have another comment from Dr. Gabriela. Yeah, in many different research areas, from the discovery of new conditions, conditions in their different conditions. We haven't talked about infectious disease that might be linked to rare diseases. That's something that we have not talked about. But here in Latin America, we can generate a lot of new knowledge. But I would like to highlight the knowledge that comes from the experts who are the patients, right? And citizen science is also very important. And it's very important to understand and generate a research surrounding all that knowledge that the patients are generating. Because we always look into the hard science of it, but we must not forget who are the experts on these diseases, who the key experts, who are the patients. So it's important to generate alliances between the physicians, the researchers, the scientists, and the patients in order to do cooperative science, something that goes beyond traditional research. Because in the end, this is going to be what helps us reach the future. Dr. Anubia, yes, please go ahead. Yeah, I would just like to add to what Dr. Marisa and Gabriela said, which is very important, not just to promote the articulation and scientific research and the development of new technology, but it's also to promote research in terms of management, administration, because here in Colombia, that's one of the biggest challenges due to the fragmentation of this health system. And there's a lot of challenges in terms of reaching rural population, but it's really important to generate these models that acknowledge these different conditions of the different regions. And it's really valuable to delve into that research and promote that kind of research. Thank you, Doctor. And Now we're going to go back to something that we mentioned, that we talked about when we were discussing data collection, which is the need of an adequate and effective diagnosis that is on time. And this is something that it's clear, we understand, because when a patient starts this diagnosed journey, it's the generation of a diagnosis is painful, not only because of the diagnosis that you reach, but all the journey that the patient must go through in order to achieve it. And it's more painful not knowing what it is that is wrong with you, right? And for instance, Dr. Rupeto was mentioned one of the strategies, which is generating alerts in the clinical story systems to generate an alert to the main physician, to the treating physician, on the possibility of a rare disease. The question is, what strategies can we incorporate from the first point of contact with pediatricians, specialists, can be at the forefront of the knowledge, hand in hand, because if you don't suspect of the disease, then you cannot generate a diagnosis. So, Dr. Gabriela. Yeah, another very important point is to generate information on. Yeah, we were talking that around 70–80% of the people that have a rare disease, it comes from a genetic cause. And there are some that can be diagnosed with relatively simple tests, but a lot of people have a lot of unknown conditions that need this state-of-the-art technology to reach a diagnosis. So something that we must generate is the information for the authorities that reaching quickly these tests have a lot of different benefits on the social aspect, health aspect, scientific aspect, research aspect, on many different aspects. So, and this might be overwhelming in terms of the financing funding, but a lot of countries have proven that reducing this phenomena and reaching an adequate diagnosis produces a lot of benefits. So I think there's a big work to be done there in order to generate this type of information in a quick manner and show it to the authorities. Yeah, this is something very important, what you just pointed out. Dr. March, please. Yeah, I agree with Doctors Gabriela and Marisa. I would like to add here that it's time to generate those changes in the health faculties, health programs, because we've been working in this since the first draft of the human genome. And so far here in Mexico, we don't have these changes in the study plans of the different programs of the different health schools. And this should be included into all the different specialties, in all the different faculties, programs that have contact with patients and with rare diseases. So this is a call to join hands and work on this. And yeah, this goes hand in hand with Dr. Marisa was mentioned, because these go hand in hand and with a network where we can share, for instance, clinical expression patterns. Just to give you an examples, in lysosomal diseases in Mexico, at least, due to the different ethnicities, there are patterns that are at a different, work at a different level. So this approach, diagnose strategies, we should share it in the region, and I'm sure that we are going to have a lot of commonalities, and we're going to learn a lot from what is being done in the different countries. And I think that we can promote this, and especially here in Mexico, we have guides clinical guides. So for instance, if we work hand in hand with the authorities to update these guides and generate more clinical guides on rare diseases would be key. And in third place, I would like to mention that the vision that we have in Mexico is that the screening programs, the early infancy screening programs are really important. And here we have metabolic conditions on one hand and rare diseases on another lane, even when the rare diseases and metabolics are considered the same thing. So it's weird, I know it's strange, but here I would like to promote a unified strategy, which is the one that Dr. Gabriela was mentioning. Well, yeah, thank you, doctor. And yeah, here what we can see is that there's a clear need of a comprehensive management and to fight this fragmentation in the health systems. So we must share all the work that we're doing. That's why we're here, Dr. March. So staying in line on the screening programs, we know that the landscape in the neonatal screening is really different country to country. It varies a lot because there are countries where we have this type of programs that are very broad, but there are some countries that are a little far behind in that issue, regarding that issue. So what improvement opportunities do we have in those programs, and why are they worth it? What's the value of them? Well, the ability to detect in the first days with just a drop of blood, to diagnose and detect, in the best of cases, 86 different conditions. That allows us to discriminate and eliminate a lot of possible diagnostic possibilities with a single drop of blood in a very short time, and at a costs that are being reduced every day. And I think it's something that is wonderful. Now, a lot of these rare diseases are gradual, right? So cognitive disorders, motor disorders are very weird, difficult. But this screening allows us to just discard a lot of different causes and it gives us a better picture, especially in terms of the picture of making better decisions and cost risk efficiency assessment. And now we have fourth generation DNA screening. But now thinking in the terms of the capacities and the budgets, this would be ideal, but we cannot work on that right now because we cannot do newborn screening with MSG because we must approach a different strategies, methodologies, enzymatic test, basic molecular biology test, microarrays, but we must not forget clinical assessment because sometimes the clinical aspect is really complex. It's sometimes you just overlook a small symptom that might be as little as just a little learning disability. We call them just like lazy kid, might have a glucose phosphate deficiency and might be a kid that only shows a little anemia. So we're facing a broad range of different alterations and conditions of our children in the different countries. But here in Mexico, we must educate better on these topics, and we must connect these screening programs with the rest of the diagnose platforms that we have set up for rare diseases. Thank you, doctor. And well, yeah, we've talked a lot, many different topics, but we are missing one, which is very important, which is access. And the question is, how could we improve access to diagnosed under the premise of universal healthcare. Yeah, so yeah, it's quite a challenge, right? So Dr. Nubia, please go ahead. Yeah, that's always the biggest challenge. That's one of the key questions. Because the families, caregivers, patients are always asking about access and how to bring down the barriers to access. How can people, organizations that represent the patients face these challenges and barriers? So here in Colombia, improving the access have had different steps in a journey that we're walking. So first is visibilization. And this is something that we've started 10 years ago when we generated the rare disease law. And this now we've included it into the general public policy, health policy. And we have built a general national plan that has been created with different stakeholders from different organizations of the civil society that are very relevant in this. So positioning is another step. The next step is guaranteeing access to, such as the universal healthcare that we have here, which is a mixed model, public-private model. And it has generated 100% of guarantee to healthcare access. This helps a lot in terms of funding. The other one is reference centers. So we must generate these centers. This is part of these centers also go in a model that it's public-private. But it's very difficult to generate the incentives to generate these centers and to guarantee the quality of the data and the access to these centers so that they have the social requirements. So transport in certain groups of rare diseases. And now what we consider also essential is that it's an a nominal information system that can just generate that comprehensive set data and follow up in real time. These aspects, without a doubt, have been the biggest steps and challenges in the journey that we've been having. Thank you, Dr. Nubia. Dr. Mendes? Yeah, now, yeah. So access is without a doubt the most complex and important one. And I would just like to share from the Brazil experience is the implementation of a specific policy for the people that have a rare disease. And this specific policy not only includes the regulatory aspects, public policies for the management of the data, but also the different strategies, as I've said, that I think in Brazil, the next step is to establish the sharing strategies and also the risk sharing strategies that we're going to have. Because when we talk about medications, drugs, this is fundamental for access to therapies, which most of the times are experimental. Most of the time they're are generating the evidence and the proof. When we have the governmental labs, the patients associations, the different stakeholders working together, looking into the data, generating the information, sharing the risk, sharing the knowledge, this becomes into a situation that's more accessible to everyone. So I think this is a very important path that we can share in Latin America, because it's something that we can look into. We can look at the experience of different countries. We can see the results of different therapies, of different drugs, and see which one can be applied into our own countries. So I think it's an opportunity to share data amongst each other, and it's a moment to help one another. Yeah, so sharing experience is key. And Dr. March? In terms of access, I think that the different health systems are very different, have a lot of we have a big variety of health systems in the region. So we have certain commonalities with the systems in Colombia and Brazil, but there are also certain particularities that are just different from any other place. And it's very complex to achieve a consensus in terms of access. What I would like to say, to put on the table, and something that can help us, is how can we generate a hierarchy in terms of action lines? As Gustavo was mentioning, what was the process? How did the process start? The experience in Colombia, how did it start? What was the process like? Because sometimes we want to advance in the process, but maybe to generate a hierarchy in the lines of actions can help us a lot. That's one thing. The other topic that I think would be something that would be really helpful would be our regulation analysis and assessment of the different countries' health systems. I don't know if Dr. Repeto, because there are observatories, I think in terms of cancers at a regional level. So maybe if we could set up an observatory at a regional level, see and understand what are the different policies that have been set up in the different countries, can generate guides and can give us a really good insight into what do we have to do in Mexico, what do we have to do in Peru, what do we have to do in Colombia, and so on and so forth. And this experience of sharing the processes through an observatory that comes from AHF could be a guide, and I think that would be fabulous. The other aspect is the technologies. We must not lose sight of the technologies, because here in Mexico we have a guide of digital health that we can share it, no problem. But we can advance in a parallel manner in terms of the regulation of the new technologies, because I know that in Colombia, there's a lot of things that they're doing. I don't know the rest of the other countries, but AI, I just saw an article that was published that obviously having into consideration all the data, public policy data things. We've seen that AI can, using pictures, AI it's a potential diagnostic tool for rare diseases. Thank you very much. So if there are no further comments, we can open the floor to anyone on the audience. If we can go into the Q&A section of the dialogue. You can turn on your microphones, or you can put them, just write them in the chat. And yeah, we're a little short on time, so maybe we can jump to conclusions. Okay, so yeah, let's just jump to conclusions, and we will have the opportunity a little bit later to take some questions. I feel that here in this table, we talk key issues regarding rare diseases, and as a region, we have big challenges. And I think that what's clear is that rare diseases by themselves, each disease by themselves is very rare, but as a whole, they have a big impact on the health systems. And we're still a long ways in terms of diagnosis and access and the different topics that we treated today. And we feel that the solutions start in spaces like this one. So we have the transsectorial participation, we have the government or governmental organizations, private sectors, civil society organizations. So it's important to have a coordinated cooperative effort to face rare diseases. So I would like to ask each of you, or to whoever wants to share something, a very brief conclusion. It can be just one single sentence that you would like to leave us with. So just a quick summary of the lessons learned from this table. Yeah, go ahead, Marisa, please. Yeah, it's clear, and Mariana was highlighting it very precise manner. These rare diseases have an enormous impact, even when they have very low frequencies, and they have an impact on the quality of life of many people. So it's important to start working so that people can prepare to face these challenges. It's also important to set up hostess programs, caregiver programs, in order to help all those who are facing a rare disease, to generate innovative tools in all the different topics that we've talked about, when it's diagnosis, tools, technologies, education, the development of policies, not only at a national, but also at a regional level, purchase systems to guarantee the transparency of, and to improve the times of for treatment, because this is the key. And equity, and it's paramount in this topic. So I think that it's really important to generate the observatory, as Santiago was mentioning, to understand what are the different processes and policies that have been set in the different countries of the region, and to understand what are the best and the better practices, so that we become really efficient and to learn from successful experiences. Thank you for the space. It was really wonderful to work with you. It was an honor to be here in this panel. Thank you, Dr. Aizenberg, and thank you, everyone. If anyone has a final parting words. Yeah, I would just like to highlight two things that we've talked about in this panel. So the first is the need for cooperation. It's a big challenge, but we share a lot of common ground in the region. So we can, so the rare diseases might be the common ground where all the region can come together and really look into learning and improving. And I hope that in the future, there's no need to talk, to have these spaces and discuss access, but we actually have landed systems that guarantee the access. So I hope that in the future, there's no need for these kinds of panels, no? Or we can just get together to discuss other matters. Thank you, Doctor. Thank you, everyone, for your participation, for contributing to this discussion. To Santiago March, Dr. Gabriela Repeto, to Dr. Nubia, Dr. Maria, Dr. Gustavo. It's a shame that Dr. Escobar wasn't able to join us, but we've had a great panel. We've had great experts. I know that we've talked a lot. We've talked about a topic and problematics that are really big, and this is just the beginning of more discussions and more dialogues that we're going to have in the future. So we're consolidating a big network on rare diseases in the region. Thank you for your participation, and we hope that we can see you in the near future.
Listos para comenzar con la segunda mesa.
Enfermedades raras en América Latina y el Caribe. En los 33 países que conforman la región de América Latina y el Caribe, alrededor de 35 millones de personas viven con una enfermedad rara, también conocida como enfermedad poco frecuente o huérfana. ¿Qué es una enfermedad rara? Según la Organización Mundial de la Salud, una enfermedad se considera rara cuando el número de personas afectadas es inferior a 5 por cada 10.000. Sin embargo, la definición varía de un país a otro. En la región latinoamericana existe una amplia gama de clasificaciones. Por ejemplo, en Brasil, una enfermedad se considera rara cuando afecta a 65 o menos habitantes por cada 100.000. En Colombia, es cuando afecta a 1 de cada 5.000 individuos. Otros países como Argentina, Chile, México, Panamá y Uruguay consideran rara una enfermedad que afecta a 1 de cada 2.000 individuos. En todo el mundo hay entre 5.000 y 8.000. Estas enfermedades, en su mayoría, tienen una base genética, son crónicas, graves y pueden ser mortales. Aproximadamente el 7% de la población humana está afectada por una enfermedad rara, lo que representa un grupo importante de personas que requieren una atención especializada en la prestación de servicios sanitarios para afrontar su enfermedad. En las últimas décadas, se ha aumentado la atención prestada a los esfuerzos para estimular la investigación, el desarrollo y la comercialización de medicamentos para las enfermedades raras. Aunque ha habido avances en las políticas y aspectos regulatorios, aún se necesitan reformas importantes. Los pacientes con enfermedades raras en América Latina y el Caribe enfrentan desafíos para recibir diagnósticos, acceder a tratamientos, obtener atención especializada y encontrar información sobre su enfermedad. Estos desafíos están relacionados con desigualdades socioeconómicas, políticas públicas en salud, situación geográfica, falta de conciencia sobre las enfermedades y cubrimiento en los planes de salud, entre otros. También es importante mencionar que las enfermedades raras no solo afectan a la persona que la padece, sino también a su familia y cuidadores. Enfermedades raras en el Caribe y América Latina, o ERCAL, fue creada con la misión de involucrar a múltiples actores con el objetivo de crear una plataforma regional de concientización. Visita el sitio web de ERCAL en ercalgroup.org para obtener más información y saber cómo puede ayudar.
Bueno, muchas gracias por continuar
Well,
con
thank you for waiting with us, and we are going to start with the second discussion table. During this, here we would like to talk about the UN resolution on rare diseases that was published December 16th, 2021. And it represents a really important item in the community of rare diseases because it sets challenges not only in terms of public policies and approach to rare diseases from a multi-sectorial agenda, but it also sets rare diseases in the agendas of the international community and the different governments. So in terms of access, social equality, and guarantee of right. So
a la realidad de los contextos
we would like to bring this resolution to the realities of the different contexts of the different countries in Latin America. Because as we've mentioned, we're all at different stages and we have very different contexts. And we're going to have Natalia Messina from Argentina. She's the special and high price medicines from the Ministry of Health. We have Melina Maia from Brazil, from the secretary. She's from the permanent Brazilian mission in the UN. We have Dr. Manuel Espinosa. He's chief of the assessment of technology assessment unit from the Católica University clinical investigation surgeon, and he is also honorary visiting fellow from the Health Economy Center of the York University. We have Dr. Nubia Bautista from Colombia. She's chief of non-infectious diseases from the Ministry of Health in Colombia. And we have Dr. Tania Palacios from Mexico. She's a lawyer specialized in human rights, and she's the juridic director of Latin American Genes AC, and she's member of the judicial power of the Mexican Federation. So I would like to start with the key points of the resolution. The first one is the inclusion and participation in society of people that have a rare disease and their families without prejudice and discrimination. The second is the guarantee to universal and equitable access to health services of quality without economic barriers. This means that the health service must not lead to economic difficulties. The third one is the promotion, the strategy and actions promotion at national levels. This includes psychosocial welfare of caregivers and patients. The fourth is the integration of rare diseases into agendas, programs, and priority of the UN and its members. And the fifth is periodic reports publishing for the monitoring on the advancement of the resolution. So to start with the questions, the regulatory framework is not only the access, but it also allows to generate policies, and the implementation of these norms is paramount to close the gaps. And the first question is, how does this resolution contribute to the advancement of these issues in the agendas of the different countries in the region of Latin America and the Caribbean?
Doctora, sí.
So yes, please go ahead.
Melina.
Dr. Melina.
Sí. Muchas gracias por la oportunidad de participar de este evento hoy en el día tan importante.
Well, thank you for the invitation. I feel that this is very important. I'm right now in New York. I was working with the publication of the resolution during October and November, and the resolution was presented to the third committee of the UN with the intention of being a resolution that could generate visibility of the challenges of the people that deal with rare diseases, patients and their families and caregivers. And the resolution was presented by Brazil, Spain, and Qatar as the leaders of the resolution. We were at the head of the negotiation of the text here. We saw a really good participation from many different countries. And we had to, a lot of countries were thinking that it was a resolution that should be adopted at a really high level from the UN as well as the WHO. But the idea was to generate a resolution that would pass through the General Assembly. And it would transcend the health aspect, but it would it would have an impact also on the human rights and the protection of the human rights, the stigma and the discrimination that the people that live with a rare disease have to deal with every day. And of course, besides the resolution was really well received. it's something that is not really new, but in terms of resolution, is the first time that rare diseases are mentioned in a resolution of the UN. So it's something that could really help Latin America. I think that the resolution is really important because it's the base for the inclusion of rare diseases in the agendas and the UN system. That is also part of the systems of the different countries. And it can help, it can become the basis so that the countries can explore solutions that will strengthen their policies in their specific context. And this will guarantee the rights of the population that is affected by these conditions. And it will have an impact on the regulation, and it will increase awareness of the challenges that rare diseases bring. So we hope that here in New York, this is just the first of many documents, of many projects that will come in the future, that will be elaborated using this resolution as a basis, as a base. And I hope that really soon we will be publishing another one and that we can continue working on it. Thank you very much.
Dr. Manuel Espinosa.
Now, Dr. Manuel Espinosa, you have the floor. Thank you, Mariana. So first, I would like to extend a warm hello to my colleagues. So the resolution visualizes or generates visibility on a lot, in a big population that is invisible or that was invisible. So for those of us who are working on the on health services, it looks as if this is a term of, or it's something that has to do with the demand on the market for this. And the resolution works around this or works on this. And the resolution mentions that the problematic of the rare diseases requires a comprehensive multi-sectorial approach. And one of the big achievements of the resolution is that the rare disease not only comes with the technical challenges in terms of the treatments, the drugs, but also the impact on the quality of life of everyone that it's around that rare disease condition. And the resolution deepens into gender inequalities and access, the defects on the lives of the patients, and access to education, access to social conditions, to working conditions, work access that people face. So I think that this framework is key because it takes us out of this perspective of demand, and it focuses toward a more comprehensive approach. Thank you very much. Dr. Tania Patricia Palacios. So good afternoon, everyone. It's a pleasure to be sharing this space with such esteemed colleagues. Now, in terms of the resolution, I would like to highlight, like my colleagues were mentioning, this comprehensive part of the resolution. And one of the most important parts that the resolution provides is to acknowledge the potential of children that have a rare disease. So it's really interesting to highlight this point, because how can we provide children, how can we focus in providing an adequate diagnose, a timely diagnose, and really generate a space for that population. Another point that I would like to highlight and celebrate is that the resolution acknowledges the potential of the civil societies organization in terms of work around rare disease. So for instance, in Mexico, the organizations are not so acknowledged or recognized in the agenda. So it shows and highlights the potential of the different stakeholders. Another thing that I would like to point out here from Mexico is that we have within our legislation, a constitutional article mentions this opening to how we interpret and how we can bring an international framework in terms of policy making and case analysis so that we can expand on the coverage of human rights. So in terms of the soft law, what's called soft law, we could integrate this UN resolution to give to guarantee human rights, not just in terms of health, but also a comprehensive care of children and all the people that are affected by a rare disease. Thank you very much, Doctor. Now we have Dr. Natalia Messina. So good afternoon, everyone. I would just like to thank on behalf of myself and the Health Ministry in Argentina to this really special event, this very special event. It's an honor to be here to see the commitment from all the panelists. So it's really inspiring to see all the work that it's being done in the region, in all the countries. Now, in terms of the resolution of the UN, we understood, once we analyzed it, once we read it and really understand it, just not to repeat what my colleagues were saying, the most important thing from that resolution is that it addresses a comprehensive problematic that are common to all the countries, especially those of the region, and it allows us to understand and think of legislations that can be adapted to the internal systems. So the resolution addresses, as my colleagues were mentioning, it goes beyond that hard aspect of health. So it addresses discrimination, equality, gender inequality, vulnerability, health access issues. So it's very comprehensive picture that the resolution paints. And what's most important is that it brings visibility, and in each of its paragraphs, the resolution clearly explains what happens and what is happening regarding the tools that we're going to have that we're going to develop in each of our own personal contexts or in each of our own country's context. Here in Argentina, we know that there are barriers and challenges specific to our context. And there are different problematics, whether it's distance, traveling, lack of expertise, lack of adherence to treatment due to monetary reasons, distance reasons, or just access to a specialist. And the reality is that from the Ministry of Health of the nation and the initiative of ACOF that is participating in this event, and we have here the chairman, Katy Peñalosa, the chairwoman, sorry, and we recognize and acknowledge this UN resolution, and we understand that they are all in agreement with the policy framework that we're working on. And we know that this resolution is going to help us to unify criteria in the region so that we can address all the problematics in a more efficient way and using a common language. So we were seeing the video, and starting from something as simple as just facing one thing as rare disease, and starting from there, all the work that we had in front of us so that we can reach a common ground, a common language to provide and generate solutions in the different countries and guarantee universal access to health, to treatment, to work, to education, and to really fulfill and achieve the 2030 goals and the plan that is comprehended by the UN in terms of the ESG goals. So thank you for the invitation. And I think more or less we are all in line with the work that must be done. We must continue addressing and working on these problematics to provide solutions and answers to all the patients. Thank you, Dr. Messina. Thank you all for your comments. And the doctor started talking on the norm of policy framework or the local area. And this leads us to the regional framework, to this big umbrella that the UN resolution provides. So as the doctor was mentioning, some countries have specific laws regarding rare diseases, but that's not the case for every country. We know that to have a specific law that guarantees and protects the rights is fundamental. And the question is, how can we progress? How can we advance in terms of setting a normative framework in the region? That's the first question. And the second question would be, now, regarding the framework that the resolution has brought up, all the member states have backed it up, have signed it. So I would like to know, what are the challenges of implementing the resolution, not just generating the laws, but in terms of implementing these laws, these frameworks, these declarations that have already been signed and approved in an international scenario and also at a local scenario. So who would like to start? Dr. Nubia, please go ahead. Yeah, so good afternoon to all the colleagues, to all the participants. So regarding the question that Felicitas is pointing, one thing is fundamental, which is this resolution makes us think on the strengthening of each particular legislative framework that are aimed at guaranteeing the fundamental right access to the patient, but also the caregivers. It's a framework that is necessary and that states and that become challenges in terms of implementation. So on the one hand, we must first understand it and then carry all the knowledge from the resolution to specific. Sorry, we're having audio difficulties. So now we're standing into the policy that is based on human ground, and this allows us to understand in terms of rare diseases, it's really important to have this perspective, especially because of the affectation in children and teenagers. Also in terms of development and sustainability. So this takes us out of the specific context of the health systems, and it carries us to homes, to education systems, and it puts us in a perspective that generates a lot of challenges, not in terms of visibilization and not only in setting up in terms of the health system, but we must have different focus and perspectives because we must work from a territorial perspective, from a gender equality aspect. And this leads to specific actions that translate into social and health services that are provided to the different communities. And this is something that is very relevant within this declaration, and that also sets challenges for which is to link psychosocial and mental health care of the people. This is a very relevant topic that must be transversal, and it precisely the pandemic brought forth. You can see it as a challenge or as an opportunity. But we consider that this resolution is very emphatic in terms of strengthening social participation in a more organized manner, that in Colombia has had a really strong expression, because in the country we have the first formal table for orphan disease management that brings all the stakeholders. So it's paramount to have this participation and to translate it into a more effective manner, and also in account rendition. So we think that these are the most important challenges that we have. Thank you. And now Dr. Messina, I think she also have a comment. Yeah, sorry, I was muted. Yeah, so basically, I think that besides the legislative framework, it's important also to consider, as Nubia was mentioning, it's how can we translate into a legislative framework, legislation framework. We can think on a normative framework, but we also have to think, how is it that we're going to implement or basically just ground these policies? Because a lot of countries are developing or implementing the policies. So the biggest challenge, what we've seen, the biggest challenge that we're facing are just basically the calendar, or staying in schedule, staying on schedule, sorry. So the most important is having the norms, the rules, and sometimes we emphasize in really small matters that we know are the goals that we must achieve, but sometimes we just happy with a legislation that acknowledges, and that's a first step. Okay, it's okay as a first step just to acknowledge and to generate visibilization, to hear all the voices of the different stakeholders that are involved in the problematics, even from other ministries, just to carry this forth. But in Argentina, we've set up a committee that it's recognized that maybe before we had the law, there were approaches to civil society organization, but they were not regulated. They were not put forth in any law that made the state accountable for the policies, for the public policies in those matters. So as I'm telling you, the norms should be there, the rules should be there. This resolution helps us to unify from the language and the common goals, and each specific context must adapt this into their own context. But what's most important is to generate visibility, the actions that are kept in mind to address the different problematics. And now we're going to talk about financing, because without a doubt, we always need the financial muscle. And I think Dr. Manuel Espinosa can help us here. In the past few years, we've seen big cooperations between the private and public sector that have been really successful, not only in the region, but at an international level, to guarantee access and coverage, especially in terms of really into high cost conditions, such as the case of cancer. How can we adapt and replicate these strategies in the region in the context of rare diseases? Yeah, thank you, Mariana. Well, I'm going to try to connect this with the previous topic, and I'm going to talk about the Chilean experience where we don't have a law for rare disease. And I would like to share something that worries me. Sometimes when we talk about a rare disease law, it's perceived in Chile from the population as an opportunity to bring money, to bring more financing, maybe from the creation of a fund that generate guarantees on new technologies. So now the question is, what's the moral argument to decide that a rare disease is going to have the priority over other patients, such as maybe kidney disease, cancer, other pathologies that are also working there? Maybe there is not a robust argument that dominates the others. So I think that for countries that don't, in particular, don't have rare disease law, the strategy should be to bring other elements other than funding and financing. That's a first idea. Because the funds and financing, the creation of a fund must be evaluated on the economic possibilities of each country. And this post-pandemic scenario, it's very challenging on monetary matters for each of the countries. So we should create a strategy on how we can advance and how we can progress without leaving behind the patients that suffer rare disease. Now, the law should focus in non-discriminatory issues, guaranteeing no stigmatization of the patients and their families and caregivers, facilitate access to the health system, and other benefits rather than the hard health services such as mental health and psychosocial care. And now another aspect should be the implementations of new strategies. I think that that's the way to progress, to advance. Now, finally, you were asking about the challenges regarding implementation, right? And I feel that the big challenge is now giving the framework that go beyond the health system. The big challenge is to give an emphasis on health, overall health. So I think that it's not just handing this to the Ministry of Health, but we must give it to an entity that some countries have them or other not, that guarantees that this will be, that all the different ministries will be working hand in hand, such as it is the proposal of the UN. And in certain case, create a fund, and that fund will probably is not going to be enough for everyone. And so we must set a prioritization mechanism, and we must create a fair prioritization framework. So those are the biggest challenges. Thank you. Thank you, Doctor. Well, now going back to the regional cooperation, which is what we're trying to integrate. We're trying to integrate within the regional frameworks. Can we unify the cooperation actions in a coordinated manner with all the different stakeholders on one side, and on the other side with the regulation and policymakers and regulators, such as the one that the European Union has? The other one would be the possibility of integrating the different cooperation. And the other one is to bring all the stakeholders within this big proposal of bringing it to a region and sharing the experiences of the different contexts within the region regarding the attention of rare disease. So I think Tania has the floor. Yes. Sorry, we're having audio difficulties. The panelist microphone is really difficult to understand it, so we'll be back in brief.
Por ejemplo, en México no contamos con una ley específica de enfermedades raras. Entonces, de entrada es como una barrera que nosotros tenemos.
So in Mexico, we don't have rare disease law, which is an initial barrier, but we compensated with other normative framework. So from health, the Constitution, we complemented with human rights, with the first article of the Constitution. And it's really because in Mexico, each of the different states have their own legislation. So in Veracruz state, there's a specific framework or legislation for rare diseases that was approved around 2017. But as the colleagues were mentioning, yeah, we have the legislation, the parameters, but we haven't had policies that standardize the policies. So at a national level, we only have 2 articles in the general health law that address orphan diseases and rare diseases. So we must integrate the health system in Mexico because we have a fragmented health system. So it's very difficult to unify criteria and financing, which you were mentioning. In Mexico, what happens with the population that doesn't have Social Security? We have a fund for health, and this is for catastrophic diseases. That's how we call it. But it only maybe 2 or 3 rare diseases are included there. But we also have, there's a different hierarchies, and it leaves out a big population or the majority of the population that has a rare disease. So what happens with people that are in hard to access or remote regions? So, and then we have the authorization for medications, no? The approval for the medications and treatments. Then, so there are a lot of drugs and treatments that are not coming into Mexico because they don't have the approval yet. And even if it's approved in Mexico, if it's not part of the health system, then they're going to be left behind. I think that we must consider all those particularities of each region. But yeah, we could coordinate, we could implement a model according to the needs. And something that I would like to highlight is that during this participation is that don't wait until there's a specific law. Don't wait. We must be aligning everything. But just start working with the resources that you already have set up in your context. And I think we can start generating on a coordination in the region. Thank you very much. Thank you, Tana. Now, Dr. Espinosa would like to mention it. I think that Natalia was before me. So Natalia, please go ahead. Yeah, no, it's just, I think that we're just addressing the topics that are most relevant because financing and regional cooperation is the most complex challenge or are the most complex challenges. But not because of that, they are the main challenges. Because what we're facing once we're start looking into rare diseases is that the problematic goes beyond access to treatment. We have diagnosis, lack of experts, lack of specialists. We calculate that in our country, we have around 3 million inhabitants with rare diseases, and we have the ultra rare diseases, and adding to that, the patients that are undiagnosed. So the reality starts well beyond access to treatment. And as I think Manuel and Tania mentioned, yeah, we're all doing the same. Yeah, we're all working towards getting those public policies to improve the quality of life of the patients, the caregivers, and the families of the patients. I don't think we need a law. Yeah, the law ordains, yeah, and makes it sustainable over time, so that countries, federal countries such as ours in Mexico, it orders at a country level, and the common problematics can be approached and addressed in a standardized manner in one or other province or state or territory. So with this resolution, this helps a lot. And then we have financing. For instance, the law here in Argentina don't mention a fund and financing. But we started to determine that these rare diseases, we can start to create the list and to create the codes and things that can be articulated within the region. So from the same country in the region, it's a list and we can review it every 2 years or every time that it's needed, and we can update it, and we created a national registry. It doesn't matter if it's contemplated under a law. It doesn't matter if it's in a territory, department, state that is more developed than other and has more resources than other. And yeah, because a lot of the times in our country, there's a big territory, it's a big area. A lot of the population needs to travel a lot to reach these attention centers. And now, other thing that we think goes beyond the registry is the creation of a platform and digital information platform, so that we can start to implement a system within the different provinces, and we can optimize human resources, because it's one of the biggest challenges that we're facing, especially regarding specialties of ultra rare diseases. And yeah, it doesn't have to be in the law. You can just create the public policy and we can carry it forward if there's willingness from the clerics. But what can we do to cooperate at a region level? And which was a question. I'm sorry if I'm extending, but I think this is really important. I feel and I think that we must create funds, and yeah, the funds are never going to be enough. We have the technology that is always further ahead than the resources and the funding. And yeah, it's unfortunate, but it's something that we must consider is, in our case, access to technology, to health technology. And also, but independently from all of that, there are personal things, there are other things that we must consider. For instance, identifying a center for rare diseases identification at a regional level, because we have people coming from other countries coming to Buenos Aires to see specialists. That's how we can start cooperating. So to guarantee that the citizens have access to health. And it's important to share information, if it's a minimum amount. Maybe if it's not the follow-up and the monitoring of the patients, but just to generate raw data, to generate the lists, and to understand where do we find not only the diseases, but also the treatment and the specialists for those diseases. And we can start sharing. It's important to set up a website so that we can share all this information. Okay, so it's important to create those regional agreements between the countries. So because we all want the access. We can provide access to a lot of patients, but the reality is that all the health systems in the region, we're all worried for the cost. We all worry on the cost, and now we have the pandemic context and the different. So sorry if I extended a bit, but I just wanted to mention that. Thank you, doctor. Now we have Dr. Manuel Espinosa. Yeah, I'll try to be brief. I think that Natalia was mentioning something key, which was access to technology. This is fundamental. But now addressing this, my worry, and I think it's the big challenge that comes from the resolution, that states it calls on the states to guarantee the rights and the access to treatments. And of course, who's not going to agree with that? But then you put in the shoes of the public fund managers. And how can we guarantee everything to everyone? So the big challenge that comes next is to provide a roadmap to the health systems, to the states, on how to advance, how to achieve economic sustainability of the health systems, because so far the resolution it delves into rights, which is perfectly fine, but we need a roadmap on how to achieve sustainability of the systems. So on one side, better purchase, smart purchases, and how can we standardize the norm in the different countries? Because we have that pharma project from Mexico with the UN, in Argentina, we're working with the BID, with the BID, with the DIB, sorry. And the big challenge is how can we implement strategic purchase strategies when we have mechanisms that constrain us?
Esos acuerdos. ¿Cómo lo hacemos? Entonces, por ahí yo creo que Naciones Unidas nos debiera ir dando ciertas luces de cómo hacerlo. Debemos ser total transparencia.
So it's important that the UN gives us a roadmap on how to work on to guarantee transparency and purchase models. How can we guarantee the resources in the future? Because right now we're spending a lot on specific populations, on specific conditions, and specific strategies that generate a big, because right now we're in an inadequate model, in a model that is not very efficient right now. So how can we change the model? So in 10 years, we're going to have more resources available to spend on these treatments, because right now we're spending a lot in dialysis for diabetics that we don't control. We're spending it on patients because had patients of heart attacks that were not prevented because our attention model is not adequate. And in 10 years, we're going to spend those high cost attention rather than innovation. So it's important to make it compatible with the help of the health systems in the region. Thank you. Now, Dr. Palacios, Tania. So yeah, I would just like to comment that, sorry, we're having audio difficulties from the original audio. We'll be back in brief.
De los ecosistemas institucionales con los que cuenta cada país. Entonces, a partir de que nosotros identifiquemos el ecosistema institucional y al hablar de ecosistema me refiero las instituciones, la normatividad, las políticas, los fondos con los que
Once again, we're sorry for the audio difficulties that we're having. We'll be back in brief with the interpreting.
A lo mejor México sí tiene de referencia con Chile o sí tiene de referencia con Colombia, y a partir de ahí poder crear un modelo de gestión que pueda ayudar a canalizar estas políticas públicas, como lo decía la compañera Natalia, y a través de las tecnologías hacer esta coordinación. Algo que me parecía interesante que mencionaban en la mesa anterior y la compañera Gabriela de Chile, que decía precisamente esta...
So in the previous table, they were mentioning that these financial aspects are not always highlighted, and sometimes most of the drugs are we're saying that only approximately 1% of rare diseases need high cost drugs. And sorry, we're having audio difficulties from the microphone of the speaker. We'll be back in brief.
Ya no puedo ir a trabajar, ya no puedo desarrollarme, ya no puedo hacer mis actividades normales. Entonces, tal vez, si tuviéramos en consideración esos aspectos, yo sé que el aspecto financiero es diferente, yo no tengo todo el conocimiento sobre cómo se hace, pero de manera coordinada y en cuanto a la gestión de recursos, sí podría darse alguna alternativa viable para la gestión de este tema de enfermedades raras. Gracias por el espacio.
Gracias, Tania.
Thank you, Tania. So thank you very much to everyone. And with this, we concluded today's event. But before we go, I would just like to pinpoint specific points that were discussed here. And I think all the interventions were very important. And you all talk about the importance to cooperate. So throughout cooperation, we can transform all these discussions into action. And it's important to take advantage of the visibility that the resolution has provided and has given to rare diseases. And it's important to share those guidelines that have already been generated, and this generate traction. And this adds to what the pandemic brought forth, which was the big impacts of the health systems on public health matters. And I would like also to mention that all the attention right now, and hopefully this is something that will be sustained, is on health. Just to close, as you were mentioning, the resolution gives us a basis, a foundation to increment visibility on the patients and how to include them in society. But to take it one step further, we need to think, how is it that we're going to innovate? Not only in terms of technology, diagnose treatments, but also into implementing strategies and mechanisms and actions to make it sustainable within our health system. It's because it's the only way in which we can achieve these goals. And finally, and maybe the most important thing is to just highlight a general conclusion. And it's something that's been mentioned throughout all the intervention, is that we must take advantage of the information and knowledge that can be provided by the patients and the organizations from the civil society in terms of collecting data and doing research. Yeah, Mariana, I would just like to mention that regarding the participation of patients organization, I'm a big fan of that. I've worked with that. We've seen that not only in Chile, but in many countries of the region, that the patient leaders and patients organizations are more professional every day, have more capacities, have better skills, and are achieving a big level of integrating into the systems and having dialogue with the health systems. And this is fundamental to all the decision and to all the policies that must be thought of in the future. Thank you. So thank you, everyone. And yeah, we're a little bit over time, but so we just like to thank you for your attention, for your participation, your enthusiasm, your hard work, all the comments, all the thoughts that you share, all the proposals, and the visions, the different perspectives and visions. And just to close this encounter, this space, in the frame of the International Day of Rare Diseases, I would like to thank all the organizers, and all the panelists. We would like to thank all the public, all the audience, and you for participating here. To the panelists, all the media, all the press media help us to communicate, and to all the institutions and organizations that help to bring this event together. Have a wonderful day, and I'll see you really soon.
Muy buenas tardes.
Enfermedades raras en América Latina y el Caribe. En los 33 países que conforman la región de América Latina y el Caribe, alrededor de 35 millones de personas viven con una enfermedad rara, también conocida como enfermedad poco frecuente o huérfana. ¿Qué es una enfermedad rara? Según la Organización Mundial de la Salud, una enfermedad se considera rara cuando el número de personas afectadas es inferior a 5 por cada 10.000. Sin embargo, la definición varía de un país a otro. En la región latinoamericana existe una amplia gama de clasificaciones. Por ejemplo, en Brasil, una enfermedad se considera rara cuando afecta a 65 o menos habitantes por cada 100.000. En Colombia, es cuando afecta a 1 de cada 5.000 individuos. Otros países como Argentina, Chile, México, Panamá y Uruguay consideran rara una enfermedad que afecta a 1 de cada 2.000 individuos. En todo el mundo hay entre 5.000 y 8.000. Estas enfermedades, en su mayoría, tienen una base genética, son crónicas, graves y pueden ser mortales. Aproximadamente el 7% de la población humana está afectada por una enfermedad rara, lo que representa un grupo importante de personas que requieren una atención especializada en la prestación de servicios sanitarios para afrontar su enfermedad. En las últimas décadas, se ha aumentado la atención prestada a los esfuerzos para estimular la investigación, el desarrollo y la comercialización de medicamentos para las enfermedades raras. Aunque ha habido avances en las políticas y aspectos regulatorios, aún se necesitan reformas importantes. Los pacientes con enfermedades raras en América Latina y el Caribe enfrentan desafíos para recibir diagnósticos, acceder a tratamientos, obtener atención especializada y encontrar información sobre su enfermedad. Estos desafíos están relacionados con desigualdades socioeconómicas, políticas públicas en salud, situación geográfica, falta de conciencia sobre las enfermedades y cubrimiento en los planes de salud, entre otros. También es importante mencionar que las enfermedades raras no solo afectan a la persona que la padece, sino también a su familia y cuidadores. Enfermedades raras en el Caribe y América Latina, o ERCAL, fue creada con la misión de involucrar a múltiples actores con el objetivo de crear una plataforma regional de concientización. Visita el sitio web de ERCAL en ercalgroup.org para obtener más información y saber cómo puede ayudar.